U.S. biotech firm Moderna says its vaccine is nearly 95% effective in preventing COVID-19. The company says the first batch could be available in the United States this year. The virus has gained fierce momentum in the country with an average death toll of more than 1,000 a day. Globally, the tally of infections is approaching 55 million. Jim Spellman has more.
Early data from pharmaceutical company Moderna seems to show their COVID-19 vaccine is 94.5% effective. Human trials also show the vaccine may limit the severity of the cases in those who received the vaccine but still contracted the disease. Full data has not been released or peer-reviewed, but the preliminary results appear promising. This comes after Pfizer says their vaccine is 90% effective. That means the U.S. is likely to have at least 2 vaccines ready for limited distribution by the end of the year. Both are expected to receive emergency use authorization from the federal government if the test data is confirmed.
We hope to have about 20 million doses of the vaccine by the end of this year, by the end of the calendar year. And we're looking forward to making about 500 million to 1 billion doses next year. But that is going to be a 24/7 operation.
Healthcare workers and the most vulnerable are expected to receive the vaccine first. It will likely be spring before any vaccine is in widespread distribution. This comes as the situation in the U.S. is getting worse, now averaging about 150,000 cases and more than 1,100 deaths a day. Some states are putting restrictions back in place, suspending in-person schooling, limiting gatherings, and temporarily closing some businesses.
Now we're facing a third wave that is trending to be more dangerous than any we have seen before. Average daily cases in our state have doubled just in the last 2 weeks. It cannot go on like this.
Public health officials fear family gatherings around next week's Thanksgiving holiday will further fuel the pandemic, making a bad situation even worse. Jim Spellman, CGTN, Bethesda, Maryland.
Well, Dr. Mary Stephen is the technical officer at W.H.O.'s Regional Office for Africa. She joins me from Brazzaville in the Republic of Congo with more on the recent breakthrough in coronavirus vaccines and how these drugs could be made available in Africa. Thank you so much for joining us, Doctor. Let's just start on these breakthroughs in the development of COVID-19 vaccines. What measures are being put in place to ensure any approved vaccines are made available to Africa? And also, I suppose one of the things that would be important is how they would be distributed. Could you speak to us about that as well?
Thank you for having me. Yes, there has been a very good news with regards to the issue of vaccine, 2 candidate vaccine. Preliminary result shows that they are effective, the Moderna vaccine and the Pfizer vaccine. And even before now in April, WHO launched the ACT Accelerator, which is a mechanism to find vaccine and innovations to support the COVID-19 response. And part of it, one of the pillars, is the COVAX facility coordinated by WHO with Gavi and other partners. This is to ensure equitable access of vaccine to all countries when these vaccines are found. So when these vaccines finally are approved, we are going to the COVAX facility will be used to ensure equitable access. But as you know, it's going to be prioritized, first of all, the high-risk population before it gets into the general population.
Doctor, let's speak about the chief scientist at the WHO who has expressed cautious optimism on the 2 vaccines, but he says much more needs to be done to ensure their safety and efficacy. What are the possible timelines?
Yes, so as we know, we have had the preliminary results about the efficacy of the 2 vaccines, but there are some questions that are still unanswered, like the duration of protection for an individual, and the protection for some population subgroups like the elderly, as well as the issues with regards to safety that needs further follow-up of the participants. So given these requirements, and while they continue to analyze the data, they need to submit at the end of the day the data for the regulatory process to kickstart. And we think that by early next year, like I said earlier, we will have some vaccine for the high risk groups. And then in the second to third quarter, then we'll begin to see additional doses of vaccines available.
Thank you for that, Dr. Mary Stephen, the technical officer at WHO's Regional Office for Africa.